you. Today's show is about going inside the most intimate places to learn about your health. Your gut, your fridge, your bedroom. And maybe the most sensitive place of all, your doctor's office. Being a patient can be nerve-wracking for many. So I've been thinking about how to help you become more comfortable when you go see your doctor. So today, for the first time ever, we're going to have a live exam room in the studio, unscripted, unfiltered. Now we're going to meet a viewer for the first time and help her diagnose her symptoms in real time. You're going to get a window into the world of how doctors think, and maybe we'll even help figure out some of the symptoms that you might have. Now, we're also going to be taking a look at what happens to your mind and body when you binge before bed. And finally, we're testing the latest sleep technologies to see if they could actually make a difference for you tonight. So let's get started. You ready for this? All right, first time ever. A doctor's appointment in the studio. In our exam room, Safia is our very first patient. She has symptoms that she cannot figure out, and she's desperate for a diagnosis and a treatment plan. What will we find, and how will it help you? Let's meet our patient.
I would give anything to know what's going on inside my body. Every day I get this rumbling sensation inside of my stomach, gas, bloating, feel a little nauseous, like I'm going to throw up. Sometimes I'm belching and I'm passing gas and the kids will yell out like, "Oh my God, Mommy, not again." Excuse me. Gosh, Mommy. Kids say that the bathroom is my office. All those symptoms are annoying, but what I'm really scared about is the tightness in my chest. It can feel like heat. I get these prickly feelings like right underneath the rib cage. Sometimes it gets so bad that I'll sleep on the recliner in the living room, and that's because when I find myself laying down flat, that's when I feel like there's fluid coming up in my throat, and I feel like I'm going to vomit, and I can't breathe. These are some of the medicines that have been prescribed for me over the years, and I pretty much saved the bottles to remember what doesn't work. Since the meds don't work, I've tried everything else I can think of. I watch what I eat. I've even tried holistic remedies. None of these things have worked consistently, so I really hope to find a diagnosis because I don't want this to get in the way of my life, my health, or my happiness.
Safia's here in the exam room. I'm going to start examining you if that's okay.
Yes, that's fine.
You can check your pulse, make sure all things, those easy things are in the right spot.
Sounds great.
Explain to everybody a little bit about the stress in your life and how that's affecting you.
Well, I'm the mother of 5 people. 3 of them have special needs. They're on the autism spectrum, so that in itself is stressful. I'm also a counselor for other special needs parents. I'm a mom, I'm a wife, and a lot of my stresses are basically trying to navigate services for my kids, worrying about their medical care. So I have to admit sometimes my own medical care is ignored.
Gets forgotten.
Yeah.
Can you take a swallow for me? Okay. When was the last time you saw a doctor for your problem?
I'll be honest, it's been a while, about a year and a half or so, and partly because of me being a mother, having to make sure that my kids' medical needs are taken care of. It's been really hard for me to really pay as much of attention to my own needs.
So I'm going to listen to your heart and your lungs, if that's okay, and maybe even your belly. So
okay.
I'm going to put a loudspeaker on this stethoscope so people can hear it.
Okay.
Can you take a deep breath? One more time, deep breath. Could you lie back for me if you don't mind? Let me just see if I can wiggle into your stomach a little bit. Is there a stomach in there?
It's somewhere in there.
It's somewhere? You have multiple layers. You weren't taking any chances.
I'm cold.
You're not taking any chances. Yeah. All right, I'll say it.
Okay.
Yeah, I'm here. See that gurgling that I'm hearing a little bit?
Yes.
You want to have a little gurgling, by the way. That means that things are moving down there.
Okay.
And sort of listening for high-pitched sounds that...
But not a lot of gurgling.
Not too much. You don't want them to be, like birds whistling in there either.
Mm-hmm.
You can sit up a little bit. That's fine.
Okay, thanks.
So I'm going to ask a colleague of mine to join us, which doctors often do. Butch Rosser's with us. He's a world expert in intestinal problems. Butch, come on out if you don't mind. Have him come into the exam room.
Okay.
Now, he created a protocol that folks all over the country can use. You've heard some of Safia's symptoms, Butch. What do you think?
Yeah, well, I was very concerned. But before I get too deep into my assumptions after hearing you, I want to go and I want to ask you a specific question. Over here, we have all kind of symptoms. Some of them you've had, some of you haven't. I want you to give me in number 1, number 2, number 3, and number 4 order, which one of these dominate your life? So give me number 1.
Number 1 would be heartburn, chest pain, and indigestion.
Okay, heartburn, chest pain, and indigestion. Number 2.
Number 2 would be difficulty breathing.
Difficulty breathing, and that's very important. Number 3.
Number 3 would be stuck in the throat sensation.
Sticking in the throat. It's there all the time. And lastly, number 4.
Number 4 is excess mucus.
Okay, good. Dr. Oz, what I'm seeing is the hoarseness, the difficulty breathing, coughing, sticking in throat, something sitting there all the time. Those are the hallmarks of silent gastroesophageal reflux, a very aggressive form of heartburn.
So folks at home, again, do the same exercise yourself. Look at those top 7. Pick the ones that bother you the most. And, we can try to piece them together with you. Okay, so what's next, Butch?
Well, for me, she absolutely, Dr. Oz, needs a scout scope, or what better known as a transnasal esophagoscopy, so we don't have to guess. So I'm ready to go ahead and find out and stop the guessing right now.
I'm ready.
You ready, darling?
Let's do it.
Well, all right.
So I've asked Dr. Portnoy to join us. Joel is he's an ENT physician, so he's also gifted in this. Now I know that you numbed up Safia a little bit, so you'll be able to put the scope in without her feeling too much discomfort. Absolutely. So take it away.
Okay.
Great.
But while he's getting ready, I really want to tell everybody what to expect. We're going to be able to examine the nose, the back of the throat, and into the stomach.
So
I'm going to be looking for ulcers and all sort of things. Joe, you ready, Joel?
Joel's already going in.
Okay, he's all, what? He's awesome. Oh, now, guys, we're going through the nose, and now there's the posterior pharynx, and she's swallowing. Now we're sliding down the sliding board to look for the vocal cords. Joel, oh my goodness. Look at those lumps and those bumps. That's called cobblestoning, right, Joel?
Correct.
And that's a sign of chronic infection. Now we're getting ready, Joel, our new GERD warrior. Joel, take us into the esophagus.
What you can do is.
There it is. That's the entrance to the food tube. Now, we're going to follow the water down into the stomach. It's like an episode of Sea Hunt, and I'm dating myself right now. That's right. Here we go. Now, so far, we've seen nothing bad, which is great, but that's not where we're looking. The real money is going to be down where the food tube actually connects to the stomach. Dr. Joel is asking her to take sips so that it can bring it down. Now, Joel, we're getting ready to get to GE junction. Oh, there it is.
Yeah.
Now, what I'm seeing right now is a hiatal hernia. There's an opening between the chest and the abdominal cavity, allowing the stomach to slide back and forth.
So that red area is stomach that's been pulled up into the chest.
Into the chest, and it should not be there. That should not happen.
That messes up that valve so that acid can come up more readily.
Yes, and it's letting me know it's giving me some important information, Dr. Oz.
Safia, you're doing great.
Thank you.
Dr. Oz and Joel, I've seen a lot of information here. So, Joel, whenever you want, I'm fine coming back because I've gotten a lot of good information. And here we go.
I'll take that from you.
Thank you.
Now, that's the esophagus. I can see what we call, it's about a 2-centimeter hiatal hernia or opening there. We're coming back. The most important thing I saw is that she did not have the precancerous lesion Barrett's esophagus. And that's very important.
Which is very good news.
That's
very
I don't know
good
if you can
news.
process that with a tube in your nose.
I know. I was going to say the same thing, but you beat me to it.
So we're going out, and we are out, and it's done. Let's give her a hand.
Oh, goodness. Thank you.
All right, so comfort Safia. Dr. Portnoy, thank you very much. In order to get a diagnosis, we also ran some blood tests. We've yet to see those results. Hold on there. You got?
Okay.
So these are all the blood tests we ran. And so when we come back, we're going to go through all of these with you. But over the break, I'm going to review them with Dr. Oster. We're going to go over the scope results. So when you come back, we're going to have a game plan of what we think's wrong.
Okay.
Because I tell you, your symptoms are commonly felt by many people. So what you learn, they'll benefit from. And then we have some strong diagnoses and thoughts about how to deal with it.
Well, I'm ready to listen.
All right.
Okay.
So we can Safia's symptoms. How can they help you spot your own diagnosis in many, many ways? So go inside the heads of doctors. That's next.